Hello, my name is Jerry Thuku. I'm a program manager with the American Psychiatric Association School and Justice Initiatives. So I'm very excited to be giving this informational webinar session and specifically for our Oakland County school community. And so I'm just excited to be able to share a bit more about what the foundation has been doing in the space of schools programming, what we're hoping to bring to your community through our Notice Talk Act at School training, as well as really just share a bit more about what this will all entail. And so I first just want to start by saying, thank you for expressing interest in this. You all are doing incredible work already trying to support your students. And so we're hoping that this training is, beneficial, not just for yourself, your school, staff, community, but also hopefully countywide, to really support students in dealing with this youth mental health crisis that we're seeing. And so let me go ahead and share my screen. All right. And so the way I'll be structuring this session is really just going through, the American Psychiatric Association Foundation, what we're doing on a larger scale, and then also how or the context as to how we got into schools programming. Of course, delving into the Notice Talk Act at School training itself, mentioning what we are hoping school staff that receive the training get out of it, also how the training is structured, and really getting into what pieces of information we're hoping to relay through this training. And then touching very briefly on two different contractual agreements, one that you as a trainer would be obligated to sign, and then also we do have a school and district contractual agreement as well. And I will be sending out, of course, this slide deck, recording, and the contractual agreements too for your review. All right. And so just bringing this a little bit more high level before delving into the training itself. The American Psychiatric Association Foundation, or APA Foundation for short, we are the charitable arm of the larger American Psychiatric Association. And so the APA is the oldest medical association in the US. It's also the largest psychiatric member association in the world, with over 38,000 psychiatrists. And so as the charitable arm of the APA, we're really working towards several pillars, which you can see shared on the slide. We're hoping to create a mentally healthy nation for all, where individuals live, learn, worship, work, and play. And so in that regard, myself, as well as Christopher Transealy, we are really working to improve how outcomes in the schools and justice space. And so the way we were introduced to Oakland County is through our ongoing partnership with the Oakland Community Health Network. We have been working very closely with the medical director, Dr. Posios, as well as Ms. Tricia Zizumbo, who is the Director of Training and Justice Initiatives. And through this partnership, we were able to deliver a Notice Talk Act at School training for Berkeley High School last August. And so this is hopefully just, the beginning of our role in expanding Notice Talk Act at school for Oakland County. And so just wanted to share this quote, which the Berkeley High School principal, Mr. Andrew Maloney, shared with us. So he said, since that training, we have noticed an improvement in the skill set of our teaching staff and their ability to connect with and support students within the classroom. We will continue to work on the skills we've learned to better serve our students and provide each of them with the mental health supports they individually require to be their best selves. And so that really just hits home better than I can say what type of impact we're hoping to have for our school staff that receive the training. And so the foundation has been working in schools programming since 2006. This training has been really deployed for over 10 years in over 200 school systems. And so we are very mindful of the fact that youth mental health, unfortunately, is on the decline as of recent years. And so we're trying to, step up and help school staff in dealing with these growing behavioral health concerns that they're seeing in their classrooms and in their schools. And that's a good segue to our Notice Talk Act at School training. So the title of the training, it really just speaks to the program framework and how what we're hoping school staff are able to come out of the training feeling more confident and equipped to deal with. And so just starting at the top there, we're hoping school staff are able to notice when students are showing withdrawn or disruptive behaviors, really clearly outlining several examples of what that is. However, we always frame it as you all really being the experts in this case, because you know very apparently what different students' behaviors are on a day-to-day basis. You're seeing it on your day-to-day. And so we're just kind of outlining several examples, of course, through our training, some that you may not already be familiar with as a potential warning sign. And so just putting a name to it. And then talk. This is where we spend a lot of our attention in this training. So we're hoping that school staff are able to talk and engage with students to really just show that they care and that they support them. It really makes a world of difference for a student to know that an adult does care about their overall health and well-being and their success. And so we know, of course, that having and starting those conversations can be very difficult. And so we do embed several motivational interviewing techniques in the training, as well as different role play scenarios, which I'll get more into really the meat and potatoes of the training further in this presentation. And then the last part of this framework, ACT. So ACT refers students to the right resources either within the school themselves or within the larger community. And so Oakland is incredibly fortunate to have several resources, really leveraging the Oakland Community Health Network that is available. So we know that not having access to care is another barrier to, of course, supporting students' mental health. And so we want to ensure that once staff are noticing and talking to students and realizing that this might be a area that a student needs additional support in, that they're acting to refer them to the correct resources. And so in that realm, I've said before, we've been able to implement this training across several school systems. And so as the foundation, we definitely wanted to make sure that this training, of course, is making an impact. And so we did a pilot study, which was able to demonstrate a 70% reduction in truancy, 89% reduction in disciplinary referrals, so our suspensions, expulsions, detentions, and a 99% reduction in major mental health events. So this is suicide and suicide attempts. And then, of course, here also is an increase in support services referrals. And so really, we know that, of course, if a student is receiving the appropriate response and connection to care, then it really should be ideally helping them be more present in class. We know schools are really dealing with rising student absenteeism, rising truancy, of course, but also students showing up to class late or taking extended bathroom breaks. And so with hopefully them receiving the support that they need, this and as well as disciplinary referrals would be on the decline. And really, at the end of the day, we're trying to avoid the worst case scenario here, which is a suicide attempt or a death by suicide. And so we want to continue to ensure that this training is providing these positive impacts. And so what we're very excited to share is this training is available for free, as right now we've received federal funding through the Substance Abuse and Mental Health Services Administration, or SAMHSA, to deploy the training. And so this training is available at no cost, no additional cost to you as certified trainers, the schools. Really, we want to make sure that this is as accessible as possible, that it is getting into the hands of the schools that really need it. And we know, of course, that funding can be a barrier sometimes, or oftentimes, I'll say. We also know time as well. And so the developers of this curriculum were very mindful of that. This training is delivered under 3 hours. And so it's really delivered in 2 parts. There is our 30-minute online self-paced e-learning module. And then that is followed by a 1 to 2 hour in-person training. And so that is the typical structure for a direct delivery. And then for this Train the Trainer event, really it would be a 4-hour time commitment in total, to include the 30 minutes online e-learning module, as well as the additional material and information that comes with becoming a trainer during that in classroom or in-person portion. And so it's important to, of course, acknowledge that there are, several trainings out there. Of course, it's good to know that that mental health training, or mental health really in general, is becoming more widely discussed. And so really what we want to share in terms of how our training is a little bit more unique is this is really geared towards all adults working in the school community. And so this isn't a training that's just for teachers, just for mental health professionals. This is a training for any adult, because we know they all have the potential to make a difference in a student's life. We're not asking any adult that's trained on this to diagnose by any means. We say we leave that to the mental health professionals. Really, the framework itself is something that should be, or we developed and created it to be something that any person, even with no mental health background, would be able to absorb and then hopefully practice. And we were very intentional about that, because we wanted to ensure, of course, that all school staff feel, more comfortable in supporting students, because there may be um, a situation where they are having to confront this, and so uh, we don't want to leave anyone out of this conversation. And we also are aware that students sometimes form closer relationship with other faculty that isn't necessarily always a teacher or a school mental health professional. And so we want to ensure that um, those tight and close relationships are all also being used to really support and ensure that students feel supported in mental health, but also their just overall well-being as well. And so just delving into how the training is deployed a little bit more in depth. So I mentioned there is this 30-minute online e-learning module. And so that module really is just touching on a providing kind of a baseline of information, key topics, facts, statistics. So you can see our really how this mental health crisis is looking on a national scale. And I think that is really important in terms of framing the conversation. It's something that is important to acknowledge because we're seeing it across every state, every region, and it's something that we need to ensure it's called out. And so um, we're also hoping the e-learning module would help you get a better understanding of several early warning signs. So I mentioned earlier, withdrawn, disruptive behaviors, really clearly outlining what those are, as well as touching on motivational interviewing techniques. And so these are ways to facilitate a more, I would say, open and engaging conversation with not just a student, but really with anyone. And so, having open-ended questions, ensuring that our language is affirming, uh, just creating a safe environment for students to feel more willing to open up and share. And the second portion of the training is our in-person, we say classroom component. And so this is tailored and customized really to meet the school's needs. And so we work hand in hand with schools ahead of time, ahead of doing this in school delivery to make sure that it's reflective of their existing referral process, that it's reflective of the language, the common language that the school uses, and we also include several role play scenarios, really to give school staff an opportunity to practice a few of these motivational interview techniques that we're sharing. And because we know if they feel more comfortable, sharing it in an environment where they're just, practicing and receiving supportive feedback, that they are more likely to then do outside of the training, following the training, do engage with these students across the framework to notice, talk, and act. And then we also are very intentional and mindful of the fact that schools, of course, need or may need additional ongoing support. And so after the training is done, that is not the end of our support of you as the trainer, but also the school as well. And so we do several surveys for school staff that receive the training. So at pre, post 3, 6, and 12 months. And really those surveys are meant to capture, of course, if there's any, changes in knowledge, attitudes, beliefs, um, surrounding mental health, but also if there are any gaps that we should really take note of. If there are several people saying that there's a gap in one specific area, then we want to make sure that you are receiving information and resources and support to bridge that gap. So, for example, we were receiving several survey feedback forms that were saying, we really don't understand the difference between privacy versus confidentiality. And really because of this, we're not able to, or we don't feel comfortable talking to students because we're not really sure what we can really promise them. And so from that feedback, we were able to create a different e-learning module that really addresses that. And so our resource and support can take many forms, but it's also several examples. We continuously add to our learning management system. We also have several handouts and resources available on our website as well. And we make sure to give a blast to everyone that's been previously trained to let them know of our continuously growing knowledge database. So this is just the outline of what really you should expect if you decide, which we hope you do, take the next step in becoming a Notice Talk Act at School certified trainer. And so just kind of starting with this first step here. So we do have a trainer agreement, which I'll share very briefly following the next two slides. And really, it's just to make sure that there's a very clearly laid out expectations of our support, the foundation, but as well as the trainer. And so what are we asking of you at the same time? And so ideally, this trainer agreement would be signed before going forward with the train the trainer session that we'll be holding. And so we'll be disseminating that soon. And so with this recording, and so if you have any questions, of course, feel free to reach out. And so you, I'm saying here are the school point of contact. And so once you've signed the agreement and then closer to the date of the train the trainer session, you will be receiving the e-learning module to go through yourself. And it's the same one that your school staff would also be receiving. So we did that so you would really be able to speak to what information they'll also be receiving at the same time. And then there would be the in-person training as well. The reason these two steps are starred is they are somewhat interchangeable, although ideally we would want you, of course, to have maybe start having conversations with your own school leadership to see if they're willing to move forward with having their school staff widely trained on Notice Talk Act at school, just so you know that you yourself know that this is something your school is willing to move forward with, and or district is willing to move forward with. And then after these steps are completed, you would work with, your school administrative team to really identify a date that works best to train your school staff. Again, we would like all adults that work in the school community, from your cafeteria workers, bus drivers, teachers, um, really all adults, to be hopefully available to do the training. Um, and so it would be finding a date that works best for most, if not all. And then before the delivery itself, we have several steps. So I mentioned earlier that the training is really customized and tailored to each school. And so um, you and several members of your school mental health support team, or even your administrative team, um, we would ask that you hold 2 pre-planning sessions, and just to make sure, that certain components of the training reflect what is the most useful and accurate for the school. Um, and then once you know who is attending the training, we do have an Excel form, very clear. It's first, last name, email, position, that we would ask you to complete ahead of time so we can upload those learners into our learner management system so they can receive the e-learning module. And then also to ensure that they have access to all of the surveys too. And something I did not mention before, but so there are really 2 separate surveys. There's one that's going to all school staff that receive the training, 10 minutes, 10 to 15 minutes, very quick and simple. And really you're providing information about your own knowledge, behavior, attitudes. And there is a separate survey specifically for uh, school and a school admin point of contact to complete, because it's collecting school census information. So what are the number of students? What are the number of school staff? To speak to the impact metrics, how many student truancies have there been? How many disciplinary referrals? Kind of hitting all 3 of those, all 4 impact metrics, and then a few other questions as well. And so this is really just to ensure that we are positively impacting the school community after receiving the training. And so there would be a baseline survey that's sent out before the school staff even receive the training. And then following, just the same as you, we would disseminate the e-learning module, and then you would do or facilitate the in-person training for your respective school or district or schools. Of course, both trainings for the train the trainer and the direct delivery are different, but we're of course happy and willing to support you in whatever way leading up to the direct delivery. We have in the train the trainer, we'll be providing you with a facilitator guide and other tips, tools, techniques to really help you feel that you're confident and able to deliver the training. All right, and then the next step here, you would do the training, and then these next 2 steps are really just in regards to these surveys. And so school staff receive the training pre, post, 3, 6, and 12 months following the training. And then this school census survey is delivered on a quarterly basis for up to 2 years following the training. And the last step here is really that saying that, we as the American Psychiatric Association Foundation, as well as jointly with the Oakland Community Health Network, we want to continue to support you through all this. And so As we, of course, receive feedback through surveys, but as we receive feedback from you all, we are more than willing to support you through all of this. If there are any additional supports that you need, we can't thank you enough for, of course, the work that you're already doing, but for your willingness to take this also on to your onto your belt. And so we want to make sure that you feel prepared to really handle and support your school staff um, in delivering the training and everything that follows after that. And so to speak more specifically to the Train the Trainer, yes, so the Oakland Community Health Network, as well as the foundation, will be co-facilitating the training. There's 2 proposed dates right now, which is, in mid-June. The dates are still being finalized, and so we may even go outside of those 2 dates, depending on feedback that we receive. The timing, it's 3 hours really for the in-person component. And the location, it will be at the Oakland Community Health Network office in Troy, Michigan. And then again, there is no additional cost to you for doing the training. So I'm going to share now a different screen just to briefly go over the trainer and school contracts. All right, so this is the trainer agreement, and really it's 3 pages, fairly brief, really just outlining, the purpose of the training, but really one key component that I'll be focusing on here is, expectations that we ask of you. So we're hoping that you would, do at least 2 pre-planning calls ahead of the in-person delivery that are at least 30 minutes long. And of course, review and prepare for the training using the materials that we will be providing, including the facilitator guide, and deliver, of course, the training to your respective school or schools. And we also have a evaluation form that is embedded into the e-learning module process. So once someone completes the e-learning module, one of the steps that they'll do following that is completing this evaluation form. And so there are four key areas really that we're hoping that you would score a 3 or above on. And then we're also asking, of course, if you have any schools that you're training, that you clearly communicate this to us so we can ensure they receive the e-learning module as well as, the surveys. And then also, so we're aware of, the reach of Notice Talk Act at school. And so we're able to support you with these deliveries too. And then there's more just contractual language here about the term, and this independent contractor status, confidential information, and a few other key pieces of information. And I definitely would suggest you read. But if there are any questions, feel free to, again, reach out. I do want to flip over to the schools contract. So this is something a school or school district would need to have signed ahead of receiving the training. And I didn't mention it in the other one, but this is also required, uh, not just by us, but also as this is funded, um, receiving federal funding through SAMHSA. And so we just want to make sure, you know, we're doing we're delivering this with fidelity, in integrity. And so this clearly outlines all the different areas that we're hoping schools are able to um, really deliver. And so, um, receiving the training, I think really to focus on maybe few areas here. This section E, as well as G, is outlining a few of the survey, or really it's just the survey information that we're hoping to collect either through the school census survey here or through the school staff survey. And then there's just a few other contractual language pieces, so copyrights, license, and these are both templates. And so once you're comfortable signing, yep, we would be able to fill this out with your school's information or your information, or you can edit yourself. And then we would just make sure that, of course, both parties receive the signed versions. All right. Well, that concludes the informational webinar session. So thank you all, of course, for your willingness again to be a Notice Talk Act at School trainer. Really, we're hoping to support school staff again in dealing with the growing behavioral health concerns that we're seeing nationwide. And so we're also continuously trying to improve upon our curriculum. And so through your feedback and through others, we're working to improve on it. And so I am very much looking forward to receiving any questions you have, and also seeing you hopefully in person come June. But thank you for your time, and yes, I hope to see you at the Train the Trainer session.